Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh and good night. Good evening. Everybody always make a joke with that opening. Kalau good night kita say goodbye lah kan. Yeah, actually I'm quite excited to be here. Thank you very much, Izzy, for inviting me to say a few words about the amazing olfactory system and our nose and the whole system of smell. I specifically kata macam let me just introduce myself dulu. I was drawn to know more about the nose and our hearing our smelling olfactory system after being introduced to essential oil naturally by Suaizi. I think it's being an ENT doctor myself, I think it is one of those sub topic of ENT which is actually very it's the least mentioned and the least research, and also I think a lot of our patients doesn't even realize that they have problems. They don't have problems, they don't realize that they have problems. Because of COVID-19 ni je lah anosmia. Anosmia ni is kita tak boleh, the term yang kita guna untuk when you have problems with smelling. Masa COVID-19 ni lah baru macam orang kata anosmia start keluar. And to tell you the truth, even amongst us doctors, even amongst us ENT doctors pun, kami pun macam barulah sibuk nak pay more attention to the nose, because selama ni kalau kita the nose pun it's more for rhinology, maknanya more of the other function of the nose, which is to orang kata condition the air yang masuk to the lungs, more for respiration and not so much for olfaction. So I was, when Izzy kata, would you like, we were discussing about how amazing the olfactory system is. Lepas tu dia kata, would you like to share it with my, apa dia panggil, oilers, you all semua ni, oilers. So I said, yeah, why not? Because I think kalau saya reflect atau saya macam orang kata bandingkan dengan the knowledge amongst doctors pun tak banyak, apalagi lah amongst the public, amongst the orang kata lay people, yeah. So I thought malam ni, and I've been reading and it's just amazing. Maknanya banyak lagi yang benda yang kita tak tahu, banyak lagi is actually speculation and theories. So so tonight I'm just going to tell you what is actually factual and what are mere theories, and what orang kata based on findings on animal studies and not human studies. So banyak benda yang kita kena take with a pinch of salt out there in the internet, yeah. If there's one thing that I always cakap dekat Izzy or Izzy is that I kata macam I think there's a lot of potential in aromatherapy, essential oil, Tapi if there's one thing that we doctors yang selalunya takut sikit dengar is this overclaiming. So, but I think the power and the orang kata apa, the potential of essential oil in making us better and be healthier is there. Cuma we should really when we say something, or when we actually promote the use of essential oil, I think we should really base not just on testimonial findings, but on true blue. Orang kata kalau macam kita nak kata benda tu facts, kita cakap okay, this is facts. Kalau kita betul this is just based on orang kata testimonial in a couple of people, walaupun macam kita kata tanya seorang ya, tanya dua orang ya, tanya tiga orang ya, tapi if there's no orang kata proper empirical study, then I think we should refrain ourselves from saying things which are as factual when it's not yet factual. So I think with that introduction, I'll start the ball rolling. Yeah. Oh, dan Izzy ada tanya tadi, dia kata, do you want me to just bagi lecture and then baru at the end of the lecture baru you all tanya? Well, in the first place, this is not even a lecture, you know, this is just a sharing session. So you can just stop me anytime. And having gone through so many, I mean, kita orang, I'm a lecturer with medical lecturer. So having gone through a lot of all this virtual teaching and you know, all these Zoom meetings and Zoom lecture and Zoom tutorials, I do realize that attention span kita cannot be more than half an hour, you know, that's max. So I'm not going to exceed half an hour. We're just going to be a short sweet lecture. Dan kalau boleh, I would like to have discussions, you know, and Q&As rather than just a one-way street of me talking and you falling asleep. Okay, right.
By the way, AZ tu nama manja I.
Oh, okay. They know you as apa, Azzi? Sue.
They call me Sue lah.
Sue. Okay. All right. Okay. So let me. Oh, I have to share this. Yeah. Oh, you disabled me from sharing. Oh, it's okay then.
I didn't.
You did?
No.
You disabled participant screen sharing?
Really? Kejap. I thought I've already bagi you share. One people I was sharing. Kejap. Alright. Oh, participant. Okay, Ken?
Okay, alright. Okay. So let me share them, yeah? Okay. So can you see my slides?
Yeah.
So awal-awal pun tengok kita dah ada some apa nama, Izzy? Ada some miscommunication. Because remember the last the title that we agreed upon was the nose, our window to the brain.
Yeah.
Kan? Well, anyway, okay, so that's what we're going to be talking about. Maybe I should just, okay, yeah. So first and foremost, let's just go quickly through the term and the definitions yang kita guna when we talk about the nose and the smell, I mean the olfactory system, yeah. Okay, so bila kita sebut pasal smell ni, kalau macam dari segi medicalnya or scientificnya, dia yang guna the term olfaction. So that is actually the process of smelling. Lepas tu odorants, odorants, you know, many ways of saying it. So these are actually chemicals yang boleh stimulate our olfaction system. So odorant ni selalunya, usually lah, of course, to be odorant, they have to be volatile, they have to be able to mix with oil, mix with water, hydrophilic, lipophilic, yeah. And then they have to be actually quite small. I think the size for them to be able to, orang kata, lekat dekat atas receptor of our olfactory system ni is 1 to 10 nanometer. So actually quite small. 1 to 10 nanometer ni is actually 1 over 100,000 smaller than the hair cell, our hair. Bukan hair cells, our hair kita ni. So there are thousands of odorants out there, banyak, memang so banyak. There's no, orang kata, there's no other way, no accepted or universal way of classifying the odorants. Ada orang cuba bagi into 7 lah, you know, musk, acidic lah, pungency and all that. Tapi there's not one agreed methods of classification. Lepas tu, the other definition kita kena guna is taste or gustation. And then dia punya chemical yang stimulate taste ni is called tastans as opposed to odorants, ya. So okay, in taste it's easier. It's slightly easier than odorant. Dia punya classification dia sebab there are 5 agreed classification. Manis, sweet, sour, bitter, sorry, and then the sweet, with bitter, sour, masin, masam, and the last one is umami. This is the orang kata MSG. It's actually stimulated by glutamate, the monoglutamate punya receptor. So in taste it's a little bit easier, and then if you were to remember masa kita kecil-kecil dulu kita belajar yang lidah tu ada, you know, where manis is on the side, tip bitter dekat hujung lidah. That one actually it has been debunked. All the areas around the tongue can actually taste all the orang kata the different taste. These 5 taste ni equally same, you know, it's not kat hujung at the root of the tongue aja kita boleh rasa bitter, dekat depan ni aja kita boleh rasa manis.
Salah lah, kita belajar sains dulu. Yang ada gambar rajah tu.
Yes, it's not. It has already been debunked. Actually, that is basically what science is. Mula-mula kita ingat findings macam tu. Lepas tu we let it go through all the macam orang kata whether it's hardy enough to withstand many more research and findings. So kalau kita macam banyak center finds bukan, then the theory is debunked. And kita come up with another theory. That's basically what empirical evidence, orang kata the evolution of knowledge lah. Yeah? So yang tu maknanya it's not like macam orang kata salah. That means masa mula-mula dia orang jumpa tu the orang kata the research methodology tu somehow gives this is why sometimes when you read research findings macam kata coffee is good, lepas tu next week coffee is bad, you know, lepas tu ni pula coffee is neither good nor bad, because kita kena really tengok macam mana research methodology is done. So kadang-kadang tu people manipulate the findings for their own you know, for their own usage lah, yeah. So okay, so that's taste. So flavor ni masih kat part definition lagi ni. Flavor pula, when we talk about flavor, it's actually a perception. Orang kata how kita make sense, our perceived sense of smell and taste, yeah. So maknanya selalu macam kalau kita kata this taste manis, tapi we don't really actually say something taste just 5 benda tu manis. Masa kita kata this tastes like coffee lah, and coffee is a complex mixture of so many chemicals, yeah. So these are just some of the definitions that you have to know. Right, so let's talk about the nose. I always find nose kucing so cute, you know, I just want to kiss them again and again. So okay, when you talk about the human nose, so kita kena faham yang kita punya nose ni kat sini je yang bony, dekat atas ni, kat sini. Ini kita panggil nasal bridge, nasal bone, ya. So yang lain ni, yang this part ni dengan this part ni dekat sini is actually just cartilage. Maknanya dia bukannya dibuat daripada tulang yang keras tu, it's actually cartilage yang macam kat telinga kita ni. Kalau macam kita tengok tulang ayam tu, yang tulang putih yang boleh makan, yang kita boleh gigit tu. So it's actually quite pliable. So kalau macam orang kata patah hidung tu, it's actually here where you can actually have depression, or kalau you patah you boleh jatuh dekat sini. Apa ni? Is nasal bridge here, ya. So lepas tu when you were to look inside, selalunya kalau macam ada anak-anak kita ke, kalau macam kita sendiri ke yang ada allergic rhinitis ya, kita selalu kata bila doktor tengok dia kata macam terbinit you besarlah, bengkaklah. So these are the tissue ni. Dia dekat kiri kanan lubang. Yang dekat tengah ni kita panggil nasal septum. Okay, so dia punya nose ni kalau ikutkannya, kalau kita tengok betul-betul dia ada masuk ke dalam, dia akan bersambung ke dalam sinus. Sinus ni adalah lubang-lubang udara dalam kita punya skull. Okay, nature Allah buat, naturally lah ya. If you were Islam kita kata Allah buat lah. Kita punya skull ni, kalau kita nak orang kata support the weight of the skull, it's too heavy. Kita punya tengkorak sangat berat. Jadi kita punya, maknanya kita punya tulang belakang, kita punya cervical tulang-tulang yang support skull ni, namely the axis and the atlas. Kalau benda ni tak ada, kalau sinus ni tak ada, dia tak larat nak angkat tengkorak tu because it's too heavy. Jadi dengan adanya lubang-lubang udara ni, dia akan meringankan sikit kita punya tengkorak. Jadi sepatutnya lubang-lubang udara ni consist of that lah, dia must just ada udara. Tapi kalau macam kita ada sinus ke, allergic rhinitis ke, so the sinuses can be filled with fluid. Or worse, kalau dia dapat infection, dia boleh be filled with nanah. Yeah? So this is part of, and then kita ada 4 pairs of sinus. The maxillary sinus, the frontal, the ethmoid, and then the sphenoid kat belakang hidung. So 4 pairs of sinus. Yeah? So, okay. Lagi satu yang saya just nak ambil kesempatan untuk cerita sikit lah, since we're talking about the nose. So, bila kat ENT klinik kami, we all selalu kalau boleh nak ni. Kalau anak kita ke yang selalu berdarah hidung. Ya. So, darah hidung sebab kenapa? Sebab dekat septum kita ni banyak salur darah. Very rich in apa orang kata, there's a profusion of blood vessel daripada banyak-banyak darah, salur darah yang kecil-kecil. Jadi ada satu area tu kita panggil little's area, where dekat sinilah yang selalunya kalau macam orang berdarah hidung. And because the darah ni yang dekat little's area, dekat septum, nasal septum ni adalah orang kata salur-salur darah yang kecil aja sebenarnya. Yang sebenarnya kalau macam kita nak berhentikan darah, kita boleh tekan aja. Ya, we can just put pressure on the nose to tekan dekat the nasal septum tu, and insyaAllah with doing that, it will stop the bleeding. Yeah, so that's why kalau kita ada berdarah hidung, anak-anak kita berdarah hidung ke, jangan panik. What you should do is you just put pressure onto the nasal septum dekat tempat little's area ni. Lepas tu, and then bila darah tu turun, memang macam kita nampak, darah tu turun, jangan suruh budak-budak kan kita sendiri ke angkat kepala ke belakang. Sebab bila buat macam tu, darah yang still mengalir tu akan menitik ke belakang tekak kita dan kita akan telan banyak darah. Bila kita telan banyak darah tu, kita akan muntah. Anak kita akan muntah. Ya? So instead, kalau masa dia tengah bleed ataupun kalau macam kita tekan-tekan masih juga tak stop darah tu, while waiting for the darah to stop, you should actually tunduk. Ya? So that the darah tu akan keluar ke depan, tak mengalir ke belakang tekak dan kita telan. So, and then bila tekan kuat ataupun kalau you nak lagi efektif ke, sebab darah kita akan kecut bila sejuk dan akan mengembang bila panas. So bila kita macam bila hari panas ke, selalunya memang akan lebih insiden epistaxis. Epistaxis adalah term yang kita gunakan untuk pendarahan dalam hidung. So selalu musim-musim hujan masa sekarang ni memang jaranglah jumpa epistaxis cases. Tapi bila musim panas dulu memang selalu. So sementara tunggu benda tu berhenti berdarah, we should actually tundukkan anak-anak kita punya muka instead of naik ke atas, instead of tunggak ke atas. Ya.
Din, ada yang tanya ni, yang ambil sampel COVID-19 ni dekat bahagian mana?
Okay. So COVID-19 kita masuk, okay. Kalau macam you tengok, let me just tunjuk ni dulu. Okay, ni this side view ya. Okay, kalau kita tengok hidung kita ni kan, you are supposed to actually masukkan ni straight ke sini, ke nasopharynx sini. Ini semua ni adalah part of the nose. Remember tadi kita kata ada sinus, ini semua nasomucosa, kulit hidung. So kulit mucosa hidung ya. So dia akan masukkan swab tu sampai dekat sini. Kat sini. Jadi maknanya suck gini. Dia bukan dan memang kan kalau siapa-siapa yang ada anak atau diri sendiri yang ada allergic rhinitis, kalau kita jumpa kami dekat ENT klinik, selalunya what we do is we all masukkan scope yang panjang ni. Kan? Panjang, in fact panjang lagi daripada my pen ni. Panjang macam ni. But it's okay because the scope boleh masuk sampai kat sini without actually, memang naturally memang boleh masuk. Kalau kita masuk ikut, kalau you tengok saya punya pointer ni, ikut the floor of the nasal cavity. Ya, dan kita masuk tu sampai ke sini. So kalau macam you tengok ataupun kalau macam dia orang sepatutnya bila dia masukkan tu, dia masukkan ke floor of the nasal cavity and it's not going upwards. Kalau going upwards tu, you in a way dia orang tak mungkin dia orang panik ke apa ke, tapi memang sekarang masa awal-awal dulu yes, banyak insiden where there's a lot of orang kata trauma and then na'udzubillah tak adalah sampai saya rasa tak ada lagi dengar yang macam orang kata teruk-teruk sangat pendarahan sikit-sikit tu adalah kan. Tapi sekarang ni no, I think every frontliners yang buat swab apa semua tu, they have been taught to actually do a proper nasal swab, and that is actually through the floor of the nasal cavity right down to the nasopharynx kat belakang. Okay. Yeah. Right. So okay. So function of the nose, yeah. So dia actually tak banyak sebenarnya. Dia prepare the nose, the air yang nak masuk ke dalam lung kita. Dia filter benda-benda kotor, benda-benda bahaya, macam COVID-19 tu. Kalau macam kita katalah macam COVID-19 pun macam kata virus, bacteria ya, harmful biological particles. So actually the nose is able to function and able to block and act as orang kata sentinel, as askar, to kill off all these bacteria and viruses. So maknanya katalah macam contohnya macam kita kata bukan semua yang dapat yang exposed to virus, contohnya like let's now talk about COVID-19 and coronavirus ni. So even if it gets to your lungs, tak semestinya you end up getting the infection because your lungs, your nose, because your nose ni ada powerful sentinels yang boleh buang or actually manage the virus, ya. So salah satunya is the mucus itself, the phagocytes yang sebenarnya ada dalam all the mucus secretion, the hair, the actual physical block itself, So ataupun kalau macam dan selalunya that's why kita katalah that is the new norm sekarang. Kalau kita nak tunggu vaksin, dengan tak dapatnya, dengan whether or not some sekarang dia kata macam now we have many more anti-vaxxers in the sense that you're afraid or you're scared of this, which is natural because it's still very very new and kita pun tak banyak, we don't have experience lagi dengan the vaccine. So the way to actually handle all these coronas and other infection for that matter is to actually increase our own body immunity. We must be, like I always tell my patients, we must be healthier than healthy. Kita kena really jaga our health now, and this is all the more important currently. So function of the nose basically untuk prepare the air yang nak masuk ke dalam lung kita. Dia nak make sure the temperature and the humidity is just right. Lepas tu dia nak also guide a nice flow to orang kata apa? To the lung, sebab sebenarnya bukannya kita air tu sebenarnya bukannya ada mesin dekat dalam lung kita yang suck in air. How does air moves from high pressure to low pressure kan? So basically bila kita nak breathe tu kita akan create a situation. Kalau siapa-siapa yang practice yoga they always say pranayamas, like breathe. What is breathing? You're actually creating different pressures so that you can actually get as much air into the lungs, and then later when you want to expulse or expire air, and then you create pula higher pressure in the lungs so that it goes out into the air. So nose creates like macam orang kata a nice funnel so that, or a nice macam orang kata tunnel lah, so that air ni boleh masuk nice and smooth into the lungs. And also to aid in vocal resonance. They say suara merdu ke, suara apa ke, different ni of the voice. The nose actually plays a part in ensuring or making sure that kita punya voice is as we want it lah. Kalau you pernah dengar hypernasality, when people cakap sengau itu kita panggil hypernasal voice. So hypernasal voice, that means there's something wrong with the orang kata the function of the nose yang menyebabkan the different quality of voice. So that's one of the function, and of course olfaction, smell. So let's look at smell, sebab this is what kita nak discuss malam ni. So basically smell ni, just to be on the ni, sebab because I promised you not more than half an hour, so I started tadi dalam 9:15
Tak apa, you can have all the time that you want.
Okay, tak apa, janji mesti ditepati. Okay, so the olfactory system ni basically kita ada let me just orang kata, okay, I have prepared kononnya slides ke benda ke, tak apa. The orang kata the basic thing is, let me just tell you, kita manusia yang kita ni how do we interact with the environment, with the outside world, through kita punya how do we get information to the brain. Sebab last at the end of the day, brain yang make sense of where we are in the world, what we do, where we are in space and our surrounding. The brain, tapi brain is orang kata encapsulated up here. Padahal the environment is all around here. So macam mana kita nak hantar information to the brain through kita punya sensory organs, macam mana kita detect stimulus. So kita ada 5 mainly sensory organs. Kita punya vision, kita punya hearing, kita punya olfaction, kita punya touch, and kita punya proprioception. Proprioception is making sense of where we are balanced in the surrounding area. So all 4 of the other sensory perception kita or sensory organs kita has to go through a convoluted macam orang kata jalan yang sangat berbelok, orang kata bengkang-bengkok untuk sampai to the brain. Basically they all go through the thalamus, lepas tu baru masuk, maknanya through the tak semua, maknanya kalau the sensory macam touch and perception and proprioception kena go through the spinal cord lagi. Tapi macam hearing and vision, they go through the cranial nerves, which is nerve yang tak perlu lalu spinal cord, tapi semua kena go through thalamus, lepas tu baru masuk to the brain, to the cortex, to the processing center. Olfactory system is the only orang kata sensory organ yang goes direct to the brain, straight to the brain. Nanti I tunjuk macam mana ya. Okay, let's look at this. So kita punya kita punya olfactory mucus is kat sini. Dekat, dia kata it's about the size of duit 5 sen. Tak banyak. 10 sen lah, 10 sen. Besar tu kan, 10 sen lah. So dekat the roof of the nasal cavity. Dekat situ kita ada all these olfactory nerve yang dia macam rambut, katalah macam ini kita punya nose macam ni ya. So dia duduk dalam the olfactory mucosa dan dia tunggu odorant tu. Remember tadi kita kata definition, odorant tu adalah chemical yang volatile, yang kecil, yang boleh masuk to the olfactory receptors ya. So dia akan tunggu benda tu masuk. So from there, from the olfactory nerve ni, dia akan cross the cribriform plate, maknanya ada satu macam very thin kata tulang, lepas tu terus masuk to the olfactory bulb, which is actually already the brain. So olfaction ni, olfactory punya system ni is actually the only one that goes straight to the brain. It's like macam orang kata memang window lah. Yang lain tu macam mula-mula kena ketuk pintu dulu, kena lepas tu tulis, okay macam kita sekarang lah nak masuk kena tulis, lepas tu kena tekan kata pintu lift dulu, lepas tu naik, lepas tu buka pula pintu ni, tunjuk pula entry card kita dan barulah sampai to the brain, something like that lah, barulah sampai to the main office lah. Tapi kita punya olfactory system ni sikit aja, kita just terus dah jumpa the olfactory nerve which goes up through the plate, cribriform plate ni, lepas tu terus jumpa the olfactory bulb. That's it. And then the olfactory bulb ni will, this is where things get very, very interesting. Okay, before that ya, let me tell you also yang tadi, kenapa kita susah sangat nak classify apakah different types of smell compared to apakah different types of taste yang kita boleh rasa. Sebab taste tu ada 5 aja ya. So sebab gene yang control the taste punya receptors hanya satu. Gene yang control the eye receptors, nak bagi contoh lah, adalah 3. Okay. The gene yang boleh buat yang kita perlu untuk odorant receptors 1000 ni adalah actually in human kita ada about 300. 1000 ni sebenarnya bila I tengok balik, see that's one of the traps. Kita kena careful sikit. So kita ada about 300. Sebenarnya kita ada 900. Kita pun sama. 1000 ni sebenarnya dalam nose of mice. Mice lab rats. Kita banyak buat research on lab rats. So manusia pun sebenarnya ada about 900 juga. Tapi sebab kita adalah macam bila kita banding dengan rat, dengan dogs, dengan cats or dengan most animals, kita dah sekarang ni we are so dependent on our eye and our vision. We suppress our genes tu. So dia panggil pseudo genes. Kita suppress the ability to actually come up with about 100 odorant receptors. Yeah. So banyak. Why do we need to be, because kenapa? Sebab odorant itself tu banyak juga. Remember tadi I kata odorant adalah chemical yang boleh yang volatile, yang kecil, yang boleh stimulate kita punya odorant receptors. So kalau kita ikutkan the ability kita ni, we can actually we can identify, we can actually rasa or bau. Kalau ikutkan dia punya orang kata maths dia, you can actually it's endless. It's like you tak terkira berapa different types of smell yang a human actually can decipher. Banyak because kalau you tengok ni tadi, dia dah lah satu, I don't want to kata apa, complicate matters. You cuma ingat macam ni je. The olfactory nerve ni, dia punya satu neuron ni boleh detect satu receptors ya. Tapi satu odoron tu sebenarnya ada banyak-banyak bukan satu odoran, satu structure. Contohlah katalah you kata apa, geranium, punya geranium punya oil tu. So
Geranium is Ailin punya favorite oil.
Yeah, so geranium tu itself ada banyak odoran. So dia akan stimulate many olfactory nerve. So bila dia dah hook up to the olfactory nerve ni, dia akan buka the channel dan electrical pathway akan go up to the olfactory bulb. Dekat sini dia akan, dia akan sambunglah dengan mitral nerve lah, mitral neurons, mitral cells, the neurons of the mitral cells. But basically, last from this the olfactory bulb ni, dia akan go straight to the to the brain, straight, yeah. So satu lagi yang I nak just orang kata to be ni, macam bila you all research ke benda ke, kalau you tengok this structure of brain, this is actually a rodent brain. Sebab banyak kita punya research is actually done on mice and rats, yeah. So kita punya brain look something more like this. You kena nampak, this is our beautiful brain, yeah. So ini depan, front kan, frontal depan, occipital belakang. So ingat tadi kita punya bulb tu dekat sini, okay, the olfactory bulb. So it rest betul-betul dekat just next to the frontal lobe, and then dekat sinilah yang bila kita tarik this, orang kata apa, the temporal lobe dengan the parietal lobe ni, then this is where things get exciting. This is where all the, kalau saya buka kat sini, macam sebab bila I discuss, sebab bila I dengar Aizee cakap pasal the brain, the blood-brain barrier, and then dia cakap pasal amygdala, pasal insula, you know, thalamus, hypothalamus, hippocampus. I kata, wow, you all, you know, I mean, I'm very impressed with her knowledge. And so
Itulah,
that's...
dulu malas nak belajar je, kata ada doktor macam you kak.
Yeah. Well, so is actually betul. Actually doktor bukannya cerdik sangat, dia cuma rajin je. You just need to persevere. You don't need too much intelligence. Okay, anyway. So from the bulb tu, see, this is the olfactory bulb kat sini. It will most of the fibers akan pergi to the parts of the, okay, dekat sini where it gets interesting. Sebab dia punya pathway tu, you can't just say it's hierarchical. Maknanya hierarchical macam contohnya kalau hearing, ya. Daripada kita kata daripada cochlea dia naik to the olive, dia naik to the ni, lepas tu naik baru pergi to the auditory cortex. For smell, to make it interesting, dia akan pergi to the piriform cortex, lepas tu dia balik semula to the occipital frontal cortex, lepas tu dia pusing dekat thalamus, lepas tu thalamus pula bagi dekat insula, lepas tu bagi pula to the orbital frontal cortex. So it's like dia macam pusing, and then there's a lot of convoluted pathways. Yeah, so this is why the olfactory system is so amazing. So kalau kita nak orang kata, for me to just that, and then kalau macam you nak baca about it, it's like it's so much. Cuma sekarang ni I think I would just like to conclude by saying macam ni. One is, it is a window, macam buka je pintu, buka je tingkap, kita dah nampak dah what's out there. And then it's intimately, kita dah tahu, macam kata-kata from the tingkap tu itself, kita dah tahu the state of the brain tu macam mana. Okay, and then satu lagi, because it is so near to the limbic system, maknanya yang limbic ni, okay, when kita cakap pasal brain, and then neuroscience is sekarang ni tengah booming. Sebab dulu people are not so interested in the brain sebab kita tak boleh, we don't have access to it. Kalau kita ada access to it pun orang tu dah mati. I mean brain, dead brain lah, usually it's dissection. Tapi sekarang neuroscience is booming because of the existence of fMRI. Maknanya fMRI ni kita ask them to do something, lepas tu kita boleh actually tengok where which parts of the brain yang light up. So in a way kita tahu, okay, kalau kita suruh orang tu orang kata smell something, oh dekat dia punya amygdala dia menyala. So kita tahu, okay, probably the amygdala, there's something going on there. So that's why sekarang ni there's a lot of new knowledge when it comes to neuroscience, and people are getting to know more and more about the olfactory system as well. So what we know about the hypothalamus, thalamus, the amygdala, the insula, are that these areas are actually involved with emotional state. Well, bila kita orang kata what is emotion? Is emotion ni benda macam orang kata inherent, maknanya kita lahir-lahir kita ada anger emotion, sad emotion. So actually emotion ni, and basically kita ni adalah we are we are chemical orang kata organism, chemical based and chemically reactive. So basically emotion ni nak menyenangkan. Macam ni contohlah, katalah kita macam kena we are slapped. Lepas tu kita kata, oh when we're slapped kita sedih, so kita nangis. So emotion ni maknanya, so slap is probably what? This is pain sensation kan? So maknanya bila kita, remember the 5 senses yang kita kata tadi? So pain sensation, so will lead to, and then bila kita sakit, katalah kita, kenapa kita kena slap tu sebab brutalnya kalau pecah barang batu mak slap kita. So in a way there's guilt, there's sadness, there's a lot of sensation. So from previous experience, kita kata okay, that is sadness, that is guilt. So sebenarnya it's just previous reaction that is associated with some orang kata response from your body. Sebab bila kita sakit and bila kita when there's pain, so maybe kita ada some cholinergic, okay, those are also complicated. Macam mana nak cakap? Okay, maknanya blood pressure kita naik or heart rate kita naik, those are reaction yang is controlled by the limbic system. So maknanya bila kita when this olfactory bulb ni gets into these areas yang orang kata deals with the function of the heart rate, respiration, the surge of the hormones, which leads to sama ada flight or fright, ataupun makna flight or fright tu maknanya adakah kita kena increase our heart rate, besarkan kita punya mata untuk nampak more ready to run, or ataupun this is the time to sleep, take it easy, parasympathetic reactions, so it is so near to all these parts of the brain yang handle benda-benda ni. So that's why it's just amazing. So that's why also I cakap dekat Izzy, I kata see the orang kata the potential is just amazing. Tapi like I always tell her, let's not overclaim and say, oh, it can, I get so distressed when they kata, oh, you can even, I can even use this in lieu of the antihistamines ke, or worse kalau patients yang budak-budak yang ada asthma ke, so instead of using salbutamol ke, you use bukan Panaway kan Izzy, benda kalau untuk respiration. I tahu Panaway.
Betul lah, it works tau.
Well, yeah, that's the thing. Sebab the working to Izzy, it can perhaps maybe due to because betul when you smell, you are actually going straight to this area where previous previous emotions are made. Okay, before that, it's not just previous. Kadang-kadang ada juga inherent reaction. Contohnya this thing called disgust, ya. Disgust ni, D-I-S-G-U-S-T, disgusting, kan? Disgusting. Disgust ni kalau ikut bahasa neuroscience, it's not yang macam, you disgust me or the food is disgusting. Bukan macam tu je. The action of disgust ni is actually a deeply inherent reaction from the insula yang this is actually a protective inherent response from the insula. So maknanya dia it's actually stimulated by taste and olfaction untuk jaga kita as body kita supaya kita tak ingest benda-benda yang akan endanger the body. Jadi bila kita discuss kan kita macam we kerut our hidung sebab kita tak nak bagi the odorant untuk masuk straight away. Lepas tu selalunya bila kita discuss yang real discuss punya sensation, you actually have this vasovagal, you actually they actually induce vomiting because you want to expel apa yang dah orang kata dah masuk, dah nearly nak masuk to the body. Maknanya dia dah masuk sikit to the mulut, dia dah masuk sikit to the hidung, so they can actually this disgust reaction ni can actually expel balik benda yang kita rasa bahaya tu. That is inherent, maknanya and it goes across species, maknanya human pun ada, mice pun ada, primates pun ada, and it's actually inherent. When we say inherent, maknanya it's not a learned behavior. Even babies pun ada disgust ni. Maknanya kalau macam ada the right odorant yang masuk, even a baby pun tahu macam that universal disgust punya facial expression. So the nose are crinkled to stop further odorant from going to up the nasal cavity, and the mouth pun macam ni, and then the whole oral and nasal cavity will close off to prevent further toxic or nauseous substance from going in. Yeah. So
Lin, jap. Ada satu kenapa manusia perceive smell differently? Macam ada orang rasa lavender wangi, tapi ada orang rasa lavender busuk.
Yes, because remember tadi yang I kata ada banyak substance yang complicated macam lavender contohnya. Dia akan ada a lot of odorant dalam tu. Maybe 100 odorant, dan kita punya gene expression, kita punya receptors, neuronal receptors tu adalah berbeza-beza. So sebab tu sampai sekarang pun kita tak ada a specific method untuk classify smell. Kita tak ada.
Remember orang sampai malam you cari seorang.
Remember kita ada 300 macam yang saya kata 1000 tadi tu, kalau macam you tengok dalam internet ramai orang cakap 1000, tapi 1000 careful 1000 tu adalah mice sebenarnya. So dalam human it's probably about 300 identified odorant receptor. So 300 ni katalah macam lavender, maybe kepada saya dia akan stimulate about 5 odorants. Untuk AZ mungkin dia akan stimulate 7 sebab dia selalu pakai, or dia selalu macam lu kata macam okay, ini odorant ini lavender yang living, ini lavender doTERRA lain, ini lavender jangan sebut. Okay, saja je. Wanted to spice up the night, yeah. So jadi maknanya that's why it is not actually a very macam orang kata objective perception. It's very very subjective, and good that you actually asked that. Sebab because the receptors are different, and then apa nama orang kata, and remember it's not something objective yang kata dia akan masuk dekat satu center in the brain and say this is how lavender tastes. Tak. It is so much associated with the limbic system, with the area of emotion yang most of the time dia akan kata okay fine, this tastes like katalah whatever lavender punya smell is, tastes like lavender. Tapi terus dia bombarded by valence dia panggil. The term is valence, VALENC. Macam kita punya valence curtain yang ada valence tu kan. So it is actually being over, most of the time is strongly associated by emotion. Jadi kita dah, okay, lavender, kalau macam kita selalu ada good experience when we smell lavender, kita akan kata, this smells amazingly heavenly. Probably masa I dulu, I tak berapa, mungkin tak terjumpa pun. Lavender is not local to Malaysia kan, Izzy kan? Dia tak boleh grow, tak grow in Malaysia, so probably tak jumpa. Mungkin for me serai, I love the smell of serai. So probably untuk kita mungkin smell yang orang kata locally available in Malaysia, mungkin it's more macam orang kata more universally accepted lah.
So meaning that it's correct when people say that the more that you introduce yourself to the smell, to a certain smell, say that you cannot stand the lavender. But then the more you introduce yourself to lavender, nanti later on you will learn to like it.
Yeah, I mean, like it, yeah, you can actually olfaction ni sebenarnya Izzy, orang dah start guna olfaction ni untuk treat post traumatic stress disorder pun. Mana yang balik all the soldiers yang dapat PTSD apa semua kan. So they are actually starting to use aroma therapy untuk treat macam dia ambil history, dia kata okay, dia macam dia cerita, I always feel very I suka makan my mother masak something lah, contohnya katalah macam nasi lemak. So the smell of that nasi lemak tu, so dia akan cuba kata okay, so bila dia orang nak suruh desensitize balik, katalah macam dia tak boleh tengok contohnya dia tak boleh, kalau dia nampak aja padang pasir, ada orang kan macam dekat PTSD dekat US tu, dia nampak aja macam desert tu, dia jadi macam gabra. So or dia jadi macam orang kata anxiety attack apa semua. So dia orang akan actually bagi the smell of nasi lemak tu while showing pictures of the padang pasir or talking about padang pasir,
So kalau yang macam tu, bahagian mana otak kita yang berfungsi tu? Kenapa dia jadi macam tu? Why the smell can affect the brain macam tu?
Why? Because it is actually very near to the area, to your area of emotion, and
yang,
it goes straight.
Limbic system yang mana, Ailin? Dia tengah-tengah ni ya?
Yeah, limbic system is actually macam orang kata a general term for your amygdala, for your thalamus, for your hippocampus, Nah, dekat sini lah, dekat sini.
Okay.
Ni. Macam kalau macam we talk about the cingulate sulcus kan. Cingulate sulcus ni yang macam in the moment punya control. Kan ada orang kata macam you can't control your heart rate, you can't control your emotion, but you actually can. Even kalau macam orang yang pandai yang boleh train, they can actually lower their heart rate. They can lower their BP just by saying, itu yang dia kata the power of meditation,
Oh, I can with the help of ilang-ilang. You should try that.
Yeah, that's right. So maknanya dan kadang-kadang, dan manusia ni memanglah kita payah nak latch on to, macam kita kata macam the yogis can do it kan. The yogi kata okay, focus on your breathing, look into your third eye lah, apa ke benda tu. So tapi for I suppose for kita, we need macam orang kata like a vehicle lah. And olfaction is one of the most it's an easy vehicle because it goes direct to the brain.
Okay. Lynn, ada satu lagi question. For those who cannot really smell, where is the problem?
Okay. So, kalau kita tengok tadi, Nak cakap pasal ni. Okay, kalau kita let's just tengok kat sini tadi ya. Mana dah? Sinilah, let's tunjuk je. Okay. Dia ada dua part. Maknanya kalau kita tak boleh smell tu, kita kena tengok whether the damage is at the primary sensory organ, which is at the epithelium, ataupun dekat any parts of the brain. That's why selalunya anosmia ni, kalau macam kalau macam kan kita kata selama ni ENT pun memang jarang sangat dapat. Disebabkan COVID-19 lah, people come and say, oh I think I have anosmia, you know. So bila lagi masa kita dapat anosmia? Masa kita ada selsema kan? Masa kita ada URTI. Macam juga COVID-19. The anosmia from COVID-19 sebenarnya is not permanent. Bila the infection tu dah go off, a significant amount of people actually dapat balik the sense of smell. So bila you tak boleh smell tu, kita kena tengok whether it's temporary ataupun it's permanent. So kalau the damage is just in the olfactory epithelium, and the good news is kita punya sensory olfactory sensory organs adalah one of those neuron cells yang boleh grow and grow and grow walaupun kita dah tua. So it's like our tak banyak badan kita yang boleh grow and grow and grow sampai kita mati. Macam kuku, keratin, you know, hair boleh. Tapi macam kalau contohnya apa? Kalau other parts of the nerve, kan selalu kita dengar, oh kalau kita nerve dah rosak, that's it lah, macam telinga. Kalau cochlea rosak, that's it, it's permanent lah, there's nothing we can do. But the olfactory system boleh regrow, which is another amazing thing about the olfactory system. Yeah. So soalan tadi tu maknanya kalau you don't, and then lagi kita belajar bila kita kaji lagi the olfactory system, kan kita kata kalau you dapat stroke dekat some area in the brain, kita kata oh that's it, habis lah, tak boleh bau dah. Tapi remember it goes everywhere macam tadi tu yang kita tunjuk kat sini tadi. It goes to many parts of the brain. So unless kalau macam it's a huge infarct, maknanya you dapat teruk sangat stroke, big area of stroke dekat the whole of the, maybe you dapat parietal, temporal, bits of the frontal, dan memang habislah, you tak boleh dengar langsung. Tapi selalunya kalau macam you dapat that kind of stroke, usually you innalillah lah, you meninggal lah maknanya kan. Tapi selalunya kalau macam orang kata stroke yang selalu stroke patients kita ada, the anosmia usually doesn't last. After a while, the brain kita very plastic ya. Brain kita akan macam orang kata ajar different parts of the area to actually take over parts of the brain yang stroke tadi, yang mati tadi. So I suppose kalau you tanya kalau kita tak boleh smell tu dekat mana yang rosaknya and whether it's permanent or temporary, it's not really so much permanent. I could probably like give half of my money in the bank and say that I don't think any anosmia is truly permanent, because you can actually, I mean, if the rest of the brain is okay, you can actually macam orang kata channel it elsewhere, and other parts of the brain will be able to take care of it. Maknanya kalau kita kata the apa orang kata the piriformis area ke yang kena, or maybe or unless katalah macam unfortunate sangatlah the whole of the olfactory bulb ada tumor which sits on it and penyekkan benda tu, then probably yes, you do have anosmia.
Okay, Lynn, there's another question, personal one. It's I lost my taste bud for 4 months, August to November 2020. Tested negative COVID. Nothing wrong with the blood test, ultrasound or MRI scan. Doctor can't figure out anything. Only changes were change of my ubat hypertension. Till now, mind-boggling as to why. Till to date, taste bud not 100% recover.
Okay. So remember I was saying just now when we talk about taste, taste is that 5 tu aja, and then taste buds also can be macam, remember kalau macam kita kata oh kita terminum air very very hot water and then we burn our tongue, and usually it becomes numb for about a few days atau kalau teruk pun 1 or 2 weeks, and then after that we get it back, we get the taste back, because our taste buds can actually also regenerate and grow. So when you can't really taste something, remember I in the definition just now we were talking about taste versus flavor, yeah? I think it's about bukan I think lah, it's actually about the majority of it actually comes from smell. So when you can't really taste something or maybe not get back your whole taste too, so it's actually you have to also look and investigate your smell in the system, your olfactory system. And then remember, it is probably not as simple as just looking for infection or tumor. I'm sure that your doctors have actually also do specific radiological examination to rule out any tumors ke apa ke. But how old are you if you don't mind saying, telling us? Because okay, nama you don't have to tell me. Sebab sekarang ni there are more and more research showing that neurodegenerative diseases, things like Parkinson, Alzheimer's, is actually macam a precursor. This anosmic periods are actually macam orang kata precursors for this kind of diseases. I'm not saying that and then you'll be like hitting your head on the knee and say, oh no, is this what is going to be? Am I going to get Alzheimer's ke or Parkinson ke? Please don't think that, yeah. Tapi because all the research
Well,
are still very
she's 48 or 49.
Yeah. So please don't lepas ni orang kata pergi like lamenting away and say oh no, is that what's waiting for me, because like I said, it's still very new. The research is actually very very masih lagi in the infancy period, tapi they are using this as actually a precursor for all the neurodegenerative disease. So my advice is, like I said, I'm not, kalau macam well, Izzy knows me, I'm not really, walaupun I'm a doctor, I'm not really keen on going to the problem and orang kata doing something when benda dah rosak, like a glorified mechanic. Benda dah rosak baru you bela. I'm more into preventing it from rosak in the first place. Yeah?
Yes,
So,
that's why you are into essential oil juga kan? kan? Say it.
Well, I'm not, you should be saying it. I'm just going to be very impartial here. But
She's being a doctor now. Okay, tak apa.
No, but I really suggest all 50 of you, I see there's like 50 participants here, let's take care of our body. I mean, if you're 48, I'm 50, we're about the same age. Remember, kalau ikut statistics, we, almost all of us here, are going to live up to about 85 to 90. I mean, look at Mahathir, look at Mko Aziz dying at the right age of 98. So we have like a good 50 more years to go. So we must take care of our body. This is not the time to be overweight, have high blood pressure, diabetes and all that. We must really jaga our food, the things that we put in our body, we must exercise, we must prevent those things. So for our dear friend yang tadi rasa macam anosmia tadi, this is the time for you to actually not just be healthy in your body, but also mental health is also very very important. Take stock of where you are you stressed, are you overly busy, so there's nothing, orang kata we only have this body, this is just the one body that we have. So let's like really jaga, and by jaga I know Izzy is not gonna like this, tapi I'm not really a fan at all with macam orang kata supplements, because like I said, I don't like to take, even kalau macam patients I pun jarang yang I kata oh you macam kalau you dapat sore throat ke benda ke, selalu memang diorang semua memang fed up kalau pergi ENT clinics kan, because if you go to clinics you or hospital, you expect antibiotics lah, ubat lah apa semua. Selalu bila you come to our clinic, we will ask you to kumur dengan air garam je ke, you know. So but that's the thing, because our body is equipped already to lawan whatever you know come their way, but we have to be healthy. Kalau we are laden with all sorts of macam orang kata gula lah, macam gula putih tu, it should actually be labelled racun in our house, you know, that gula putih tu, we should actually, I've actually trained myself to stop taking gula putih when I reach 40. And we should actually be teaching our children also to not take those things.
Okay, we have lavender honey, Lin, new product. So nanti you boleh try. Anyway, kita ada satu lagi question ni, maknanya...
Oh, it's actually 10, is it?
Yeah.
I'm so sorry.
Okay, wait.
Yeah.
Maknanya brain kita akan relate the smell to... this is back to yang before ni punya issue ya. Maknanya brain kita akan relate the smell to experience first, baru dia akan interpret whether the smell is good or bad for us. Is it?
Yes. Okay. This is actually quite an intelligent and interesting question with interesting answers. So there are two types of pathways. One that goes straight to macam orang kata lavender, you know, yang register. What is it chemically? Tapi itu pun dia akan go to, remember dia akan go to banyak station, because one receptor just carry one odorant punya stimulus. So ada that pathway. Tapi ada that yang disconvoluted pathway yang terus pergi to emotion, terus pergi to ni. So maknanya and to say which one is stronger and all that, itu pun masih lagi sama-sama. So it's not like a purely objective interpretation the brain does. It doesn't. With olfactory, with olfaction, with odorant, it is still very macam half goes to the objective interpretation, half will be associated with the sensation, with the feelings, with previous experience, and so on. Okay.
Right.
Yeah. So, before I forget, walaupun the olfactory system yang kita kata window tu, tapi ada juga this one from the trigeminal and the facial nerve. Jadi maknanya maknanya ada juga yang go through the usual normal way through the thalamus, you know, and then baru to the cortex, through the 5th cranial nerve and 7th nerve and a little bit of 10th nerve. Maknanya bukan saja the olfactory nerve lah. Ada juga other nerves, ya. So I think that's all. And then katalah macam kalau you pergi ENT klinik sekarang ni je lah, macam kalau you pergi kat UIA pun, kami punya klinik kat where I worked in UIA. So baru ni lah yang kita ada, itu pun kita ada this UPSID test, University of Pennsylvania punya KIT test. Itu pun masih lagi research level. Our master student is actually, one of our master student is actually doing this. Kalau tidak tu, just a simple macam you bau tak bau kopi ni, and then kalau ada minyak cakapak dalam kita punya, you know, klinik tu, kita kata okay, can you smell this? It's so not scientific. I mean the test that
And now your minyak cakapak tu ke apa, Ailin?
Oh yeah, Fenway.
Yes, I love you lah.
No, but I kena kutuk Izzy dengan my husband. Dia kata, minyak cakapat
Your husband yang belakang you tu, kita salam kat dia.
Dia kata minyak cakapat RM3 je, benda Allah ni is like RM100 lebih.
Nick, it's different, okay Nick? You should come to my house.
Okay. So these are all the macam orang kata current research. I think I've mentioned, oh yeah, and another thing, I'm so sorry to all the men listening in, tapi memang again and again, many research have shown that women on average have better sense of smell than men. I suppose this is because, you know, from evolution theory lah, the men go and cari makan, the women folk yang kena cari jaga family and all that, and kita yang orang kata apa, kita yang salvage for makanan and all that. So we are very sensitive towards different types of smell at different at a lower intensity than the men. Yeah. And then genetic influence. Lepas tu kalau smokers, ya, smokers yang actually past smokers, you can actually do get your kalau because of the effects of the monoxide ke carbon dioxide ke, bukan monoxide lah, monoxide. What you do get a little bit of monoxide exposure as well. You can actually get back your orang kata normal function, because remember it is still the human body can actually regenerate olfactory neurons, so you can actually get back your need if you stop smoking. So that's actually a plus point untuk kita encourage our friends, our husbands to stop smoking. Lepas tu, yes, chemical odorants, hazardous odorants, macam yang definite ni macam, you know, all the barang-barang yang kita jual apa, thinner, you know, yang something very noxious macam tu, that can actually damage our our olfactory neurons as well. And then sleep will definitely decrease our ability to decipher different odorants. So memang 8 hours of sleep is one of the, selalu cakap macam tu, jaga makan, exercise, bla bla bla, tapi kita lupa we must have enough sleep. 8 hours, 6, 7, I think minimum pun 6 lah, 6 to 7 hours, but the best kalau you boleh dapat a good 8 hours sleep a day, that's very good. And this one,
we have yang living baru masuk Rutavala, Ailin, it can promote deep sleep.
okay.
Nah, I buat iklan. You cakap I iklan. Kan? It's supposed to be that way, what?
Yes, yeah. And this is where yang I kata the last one tu yang Parkinson's, Alzheimer's, you know, now they are using smelling olfactory tests to actually say whether or not you are at risk of developing these diseases. This is actually very interesting. I am definitely going to look into this. Tapi yelah, bila when you talk to my fellow ENTs pun, dia orang macam what, you know, like, because like I said, this is even one even amongst the doctors, amongst the ENTs, probably among the neurosurgeons tak, dia orang tahu belah-belah je. Maybe the neurologists lah would know about this, tapi for us we're like, you know, this is really news. Yes. So and then satu lagi, okay, just the last one. Now they're using whether this window, our nose ni kan, the window to the brain ni, they're probably saying that sebab kalau kita nak kalau kita nak bagi medication ke benda ke to the brain, kita kena cari some vehicle that can actually cross the blood-brain barrier. Sebab blood-brain barrier dia banyak, dia macam kita punya, orang kata ni lah, nak jaga supaya not any Tom, Dick and Harry boleh masuk dalam brain kita. Tapi sometimes kita nak deliver necessary drugs or compound. So diorang sekarang ni banyak research is doing in determining what kind of carrier, what kind of vehicle yang kita boleh guna untuk bypass the blood-brain barrier through the olfactory system ni. So yeah, so I think that's it. I've reached the end of the ni.
Alright, kita kalau siapa ada soalan, you can unmute yourself lah, tanya.
Oh yeah. Yes,
wait, Lin, don't
okay.
react.
Okay.
Ada
alright, so I'll stop sharing, yeah?
Yep. So you can unmute yourself and then you ask lah. Bukan senang lah kita nak dapat Dr. Ailin
Dr. Hi Dr. Ailin.
Hello.
Melissa ni.
Liz, do you kenal Melissa? Melissa Saila.
Oh, hi. Yeah.
Kenal tak?
So, kenal, of course.
Oh, okay. Can you hear me?
Yes. Liz?
Oh, now we can't hear you.
Alah.
Okay. Now
Keep
kita dengar.
small. Hello?
Yes, dengar.
Teruk
Ah,
lah
yes.
line Aisu.
Oh.
Tak cakap dengan doktor terus teruk ke?
Dah boleh.
Taklah. But actually, thank you for the sharing, Doctor. So pleasant and best sangat sebab easy to understand for all of us.
Oh, I hope so.
I want to ask something. Nothing
Yeah.
about this clinical thing. It's just like about the essential oil kan. Before Young Living, have you tried other brands?
Oh, okay. Well, actually, I think I am more of a makcik minyak than AZ because my experience with ni, I think was 10, Yang Living ada ke 10 years ago, AZ?
Tak ada lagi.
Tak ada lagi kan?
Not in Malaysia. Ada.
Not in Malaysia lah.
Oh, okay. No, that was when I was in UK. So tak. So yeah, but my first exposure was with yang AZ tak pergi sebut tadi. so that was my
Tapi dia beli PSK, okay? Dia beli PSK.
PSK tu apa?
The premium starter kit.
Yes.
The set that you get.
How is it different, Doctor, from the other? Is there any difference? Like let's say the frankincense, or what's your favorite is geranium? Is there any difference? Because actually I've never tried the other brands. I mean not the other brand, but that brand I tak pernah. So ada beza tak?
Well, I have to tell you the truth. I don't think there's any difference sangat. And then bukan there's not any difference. I think it's a different smell. Macam contohnya, pen away I suka. I tak tahu what's the need of your pen away, but I really love this smell. And I think it really works. Kalau macam sakit ke benda ke, memang urut dengan benda ni, I mean roll dengan benda ni memang ni. Tapi premium, I rasa that bukan doTERRA and bukan you all punya geranium, I suka another this one I brought in Canada. So I don't think kalau macam Melissa, kalau macam you nak tanya yang whether Young Living better ke or not better ke, I think you all semua memang basically you are producing essential oil kan, so hopefully they all are essential oils.
Bukan better, I just want to know macam kata perbezaan tu ada ke lain je, because you are very sensitive of course of tentang scent kan, tentang hidu and all this kan. So is there any difference? It's not whether it's mana yang bagus, no, it's not about that. Tapi perbezaan tu ada ke? That's all.
Yeah, I think memang ada. Different preparation memang different. I think different company has different preparation kot.
I see. Okay. Faham. Sebab kita layman kan. Jadi kita tak begitu detail dengan benda ni, kita tak tahu sangat kan.
Yeah.
So I wouldn't know, really
Yeah, tapi I think it's good also for you to macam orang kata question yang Living punya manufacturer ke benda ke, like really ask them what is your carrier, what are the things that you use, what's the method of trying to to produce the oil kan. So that
tahu tu, kita tahu. Ada video
tu tak katam lah semua dah.
Ya, katam lah tu.
Okay.
That's why we believe in Young Living, Din. Okay, ada lagi ke soalan-soalan? Ada lagi tak yang nak bertanya?
Dengar ke?
Dengar. Fatin, go ahead.
Okay, ni soalan daripada kawan saya. Dia tanya, ada perbezaan tak dari segi efisiensi bila kita guna essential oil ni topically dengan aromatically, means bila kita diffuse dengan kita buat topical application, which one is more effective? Okey teacher.
Izzy, I think this is your question, isn't it?
No, they want to hear from you, the doctor. Meaning that, okay, say, itulah bila nak jawab yang ni kan. Dia tanya kalau kita diffuse dengan kita do the topical application tu. Do you
The
have any
mechanics.
idea ke apa ke? Yang mana satu
Well,
lebih
kalau
bagus?
kalau nampak daripada the macam methods of delivering the ni, of course just now when kita kata pasal the olfactory system, it is the fastest and the most direct. Cuma maknanya kalau but of course with the functioning olfactory system lah. Kalau topical, then it has to go through the blood vessel, and then bila dah masuk blood vessel tu, semua yang masuk blood sistem kita ni kena pula go through the liver, because liver is the universal filtering, it has to go through the filtering system, so ada yang liver akan block, ada yang liver akan ni bagi pass through. So I suppose kalau benda tu macam the fastest is actually inhalation lah through the olfactory system. Tapi kalau macam katalah I think memang the olfactory kalau ikut that way lah, tapi kalau macam mungkin dia depends on the what is it that you want to deliver also.
Ya. I rasa macam kalau you nak guna tu untuk pain relief, sakit-sakit lutut ke apa benda ke, of course lah topical kan. Tapi kalau for memory, for emotions ke, I think inhalation lah kalau daripada segi yang macam yang kita discuss ni.
And then topical ialah macam topical macam yang your Panaway tu dia ada eucalyptus kan, dia ada camphor kan. Jadi maknanya so benda-benda tu probably you want to go, katalah you sakit lutut. So kalau you nak go through the brain down to through the
jauh perjalanan lah.
Limbic system tu jauh jugalah.
Do you Lin, soalan. Do you believe that some aroma boleh stimulate your brain tu untuk jadi lebih rajin ke macam tu?
Untuk jadi lebih rajin.
Dia buat you jadi rajin, you jadi
so those things I mean as I suppose as a scientist that's it's not a straightforward answer, and I think you can't just say yes, or you can't even say no kan. Tapi there's no like rajin center where you stimulate the rajin center.
Tak ada ya?
Tak ada. But then kalau you nak cakap pasal flight or fright, sympathetic or parasympathetic, that one ada. Tapi tak semestinya sympathetic is rajin and parasympathetic is malas. Kan? Walaupun sebenarnya parasympathetic tu macam orang kata that postprandial. Macam kan bila kita makan, lepas kita makan kita rasa macam kita nak baring, nak relax semua kan. That is actually the parasympathetic system that kicks in sebab dia tak nak bagi kita fikir semua, sebab most of the darah tu dia nak pergi to the intestinal system so that dia boleh hadam makanan. So masa tu kalau boleh dia kata okay, jangan baca, jangan buat benda lain, nak divert all most of the blood to the intestinal system supaya kita boleh hadam makanan cepat-cepat. And then bila dah habis hadam semua, okay fine, barulah you nak buat apa-apa. So you ada that, kalau in a way you can say lah that is the malas system kan. Tapi there's no like, kalau senang kalau macam tu easy, lama dah orang macam okay ambil kita stimulate the rajin otak, rajin part of the otak. So you can't really, I mean kalau you nak cakap tu you must cakap I suppose beralas sikit lah, not say okay you take this and anak you jadi rajin. Tak adalah.
Taklah cakap macam tu. Okay, ada lagi?
Ada Kak Su,
Ya.
Sharon sini.
Sharon.
Thank you Kak Su arrange this session. Thank you doktor. Sharon ada soalan nak tanya. Okay, kalau macam Sharon noticed that some essential oils will make my nose even drier. And sometimes kalau ada EO yang akan buat my nose yang dry, I mean dalam tu dry, and there could be possibly some little bleeding. Tapi kalau macam pada pandangan doktor, kalau macam untuk orang yang sinus and especially orang yang sensitive nose, what would be your recommendations on diffusing the oils like for a beginner? Sebab everyone will react differently, but what is the recommended time for diffusing, especially macam sesetengah orang mereka tu dia terlampau sensitif dengan EO.
Okay, kalau orang tu I mean Sharon, kalau are you also do you have allergic rhinitis or rhinosinusitis?
I have sinus. And I have like I think about a year ago, then I triggered sinus, but I was diagnosed with acute sinus that time. Like for now pun lepas I buat the minor procedures on the sinus, but I noticed like some oils like rosemary or like clarity, there are a few more, like for example like rosemary, rosemary is like, we all know rosemary is also good for respiratory, but I just can't get along with rosemary. If I diffuse it like even 30 minutes also, I find it like it dry my nose. And it's not that I have difficulty in breathing, it's just that the nose is more dry as compared to others.
Okay, that's interesting, because when you have allergic rhinitis or sinusitis, or allergic rhinosinusitis, a combination, one of the things yang kalau macam you visit ENT clinics, they will say avoid the allergens, avoid the things that you are allergic to. And then selalu macam patient akan tanya, apa yang saya kena avoid doktor? And then the doctor will say, you have to find out apa benda yang you tak boleh, apa benda yang you alah. So avoidance of allergens is actually a modality, treatment modality. Instead, kan selalu kalau you ada allergy, you ada sensitivity, doctors akan bagi nasal spray, ataupun kalau macam teruk sangat you dapat nasal discharge apa semua, kita akan bagi antihistamine, claritin, clarinis, pseudoephedrine. Tapi kita akan kata juga you have to avoid allergens, avoid benda yang you allergic to. So maybe dalam, and remember, so benda-benda yang macam orang kata rosemary tu adalah a combination of so many odorants. So maybe one of those odorants tu yang you are sensitive to. So with sensitivity, some diorang kata okay, kita macam expose lagi supaya body gets used to it. That's actually one strategy. Tapi there's also kena careful juga benda tu, sebab there's also this hypersensitivity reaction. Siapa yang macam kalau siapa yang pernah kena, yang dia dapat severe hypersensitive reaction sampai every mucosa bengkak, it's not just bengkak tu dekat sini yang susah rasa nak nafas. Worst is your saluran nafas pun akan bengkak, and that one memang sangat bahaya. People can die from hypersensitivity reaction. So that's why kalau you nak macam teach yourself to be desensitized to something, you have to do it carefully. You tak boleh macam okay, cuba saja, essential oil ni is orang kata macam rosemary is actually good for respiration. Tapi bila Sharon pakai, you rasa macam susah nak nafas, then take it slow. Don't like expose lagi thinking that your body can do it. Yeah, so berpada-pada with the so when you do have patients and sensitive to certain or some of the otherwise kalau macam you kata oh semua orang macam okay je dengan benda ni, but for that person they may be sensitive to that particular oil. So be careful with the exposure to that particular thing.
Okay, thank you.
Okay.
Ada lagi? Kita dah pukul berapa ni? Dah pukul 10.30 dah.
Doktor,
Ada.
Kak Su, I pun ada soalan nak tanya doktor.
Sila.
Okay.
Doktor, how about snoring? Ada kaitan tak dengan sebab actually my husband dulu dia tak snoring tau. So after dah nak masuk 10 years ni, dia macam dia dah start developing that kind of snoring lah. So masa I start join, I tengok tips on, sebab memang kita ada EO yang boleh fix that problem lah. So mula I try dengan si Dawud tau. So lepas tu dia tak si Dawud, because the tips is pakai dekat kaki, dekat your big toe. Tapi lepas tu dia macam dia tak jalan lah kan, tak jadi apa. And then I try Valor. So bila try Valor, dia stop. So dia memang does it really works to fix that snoring problem ke macam mana?
Okay, yang Valor and apa ni Seda apa semua tu, I think kita bagi AZ untuk jawab benda tu. Tapi dari segi medically, snoring is actually not uncommon, and snoring sampai menyebabkan sleep apnea is actually very dangerous. Maknanya bukan saja snore tu memekakkan telinga kita kan sampai kita susah nak tidur, kata oh fed up je dengar dia snore. Tapi the fact that dia snore tu, dia boleh dapat ada benda yang kita panggil sleep apneic syndrome, sleep apnea. Sleep apnea ni maknanya kalau macam kalau macam you Fai, kalau you dengar kan husband kita snore, dia macam snore kruk-krak, lepas tu stop. Lepas tu dia dia macam tarik nafas kan. Lepas tu dia snore balik. Lepas tu dia macam stop sekejap, lepas tu dia tarik nafas. Itu maknanya memang ada sleep apnea. So kalau ada sleep apnea tu, that's very dangerous. Okay, you can actually try lah dengan whatever essential oils yang di ni. Tapi I do hope also that you 64 of us who are here, please don't ignore very bad snoring and sleep apnea, because that can actually kill. Sebab you imagine sekali yang dia stop untuk bernafas tu, that's actually one apnea. Apnea adalah episode where you don't get oxygen to your brain. So kalau satu malam kita tidur 8 jam, kalau kita dapat sleep apnea ni katalah 4 kali je sahaja sejam, pun dah berapa kali dah apneic period di mana brain kita tak dapat oksigen. So it's actually very dangerous. So siapa yang rasa macam suami dia, usually husband lah, and then usually sleep apnea ni is obstructive. Maknanya when they start to, when kita dah tua, everything is macam orang kata not as tight as before kan. Jadi termasuklah juga kita punya laryngeal muscles and pharyngeal muscles. And then tambah pula when you've put on weight. So dekat area ni banyak fat punya ni apa semua. So that's why bila selalunya lah sleep apnea ni akan creep in bila kita dah umur 40 lebih, 50 lebih usually, and it's more common in overweight men. Who are smokers. Yeah.
Tapi dia ada kaitan ke dengan kata kalau macam certain days tu dia exhausted?
Yeah, bila
ada kaitan tak?
Yes, when you are really tired, that means your muscle will relax more lah. Jadi selalunya what happen is that your tongue, bila you baring kan, tongue kita tak tutup kita punya airway. Tapi kalau kita penat sangat, dia akan topple kat sini. And badan pun macam jadi badan kita ada macam orang kata security guard lah, macam dia akan every time kita stop bila dia tak dapat oksigen je, dia akan, oi bangun, dia akan nudge the body untuk kita, macam orang kata kita buka the airway. Jadi snoring tu sebenarnya is also one of the need to go against block. Sebab tu dia berbunyi tu, dia nak juga tarik nafas, jadi dia tolak je gerak. Lepas tu okey, tutup balik. Lepas tu gerak, tutup balik. So that's why kalau macam
I see.
You are tired, the snore gets louder.
The thing is dia tak tahu kita yang terjaga kejut dia.
Yes, memang macam itulah. And then sebab tu kata dulu-dulu the concern is just for the partner. Kesian partner tak dapat tidur yang cukup apa semua. Tapi now we also know that orang yang berdengkur tu pun is suffering juga. And so and then it is a very highly correlated sleep apnea with stroke and heart attack. So kita, siapa-siapa yang rasa macam husband dia ada sleep apnea syndrome tu, please go for proper check-up.
Lin, ada
Alright.
satu soalan ni. Maybe not your scope lah, tapi ikut-ikut lah you boleh bagi advice sikit. My daughter ada speech delay, now 5 years old. Now speak like 3 years old. Speech therapist said. What do you think pasal kids yang ada special needs ni supaya dia boleh bercakap ikut her age?
Oh, well, the first thing kalau anak kita ada speech delay or ni is to go for hearing assessment. Have they gone for, have she ke he?
She.
She, okay, especially if it's a girl, did you ever bring her to
Aisyah, unmute Aisyah.
Ya.
Oh, done that.
Dah. Dia dah buat hearing test tu. Lepas tu bila dia dah buat hearing test tu, the doktor pun cakap memang dia normal jugalah. Tak ada masalah dengan dia punya telinga dia tu.
Maknanya dah bawa pergi jumpa ENT
Yes,
specialist.
Ya, dah jumpa dah.
Oh, alright. So, well, kalau macam normal hearing, behaviorally pun okay ya? Tak ada macam orang kata ada behavioral problems?
Now dia punya behavioral problem tu sebelum ni memang ada, tapi bila dia dah join occupational therapist, memang dah settle lah masalah occupational tu.
I see. So maknanya sama jugalah, then you also have to further extra stimulate dia punya hearing system. Remember for them to cakap, they have to build the memory. So you kena cakap banyak. Selalu kita cakap dengan mak ayah, the best speech therapist, macam you kata behavioral tu, you bawa pergi OT kan, occupational therapist. So kalau speech ni, the ni is to bawa pergi jumpa speech therapist kan. But the best speech therapists are the parents. Kita galakkan sangat-sangat that you withhold the usage of gadgets to them. Instead, you baca buku banyak, you sing, you cakap banyak, you know, we have to really talk. And then satu about Malaysian parents ni, kita tak cakap dengan anak kita macam kita cakap dengan adults kan, kita baby talk or kita tak cakap banyak. So we should jadi macam orang kata parents yang romeh lah. Kita kena cakap, you know, as we prepare breakfast ke. Kata okay, I tengah potong roti ni, so that lepas tu kita boleh sapu pelantar. You know, like you have to buat running commentary in everything. It is actually, kalau macam you ada appointment with speech therapist?
Ada, baru je. Pagi tadi baru lepas dia punya terapis. Actually kita baru start balik dia punya terapi ni bulan 1 tahun ni. Jadi selepas beberapa bulan, itu pun sebab kita PKP, so banyak dia tak pergi terapi kan. Tapi masa bulan 1 dia jumpa dengan terapi tu, dia macam budak umur 1 tahun. Dia punya level bercakap tu umur 1 tahun. But now saya pun ada jugalah guna beberapa EO untuk dia dan pergi juga terapi. Now dia boleh dah bercakap. macam budak 3 tahun. So memang terapis pun memang nampak dia kata perubahan dalam tempoh yang singkat tu memang cepat lah. That's why dia kata sebab sebelum ni doktor memang diagnose dia macam ada autism sedikit. Tapi dia kata dia macam ada mild autism but dia kata tak obvious sangat lah. So dia kata nanti kita tengok dia punya perkembangan. But then bila dia jumpa balik dengan doktor masa Julai hari tu, doktor pun memang tak galakkan dia masuk dalam tadika yang ada special kids lah sebab dia kata mungkin kita boleh enhance dia punya ni.
Ya. You should try instead of jangan hantar special punya ni ke go inclusive. Dan macam katalah stimulate dia with lots and lots of inputs on speech and hearing.
Ya betul. Okay doktor, thank you doktor.
Welcome.
Okay. Zah ada soalan kan?
Okay, doktor, thank you for the best sharing malam ni. So, I nak tanya, bukanlah nak tanya, nak minta pandangan doktor je kot. Sebab macam kita ada essential oil, contoh macam transformation, hope. Lepas tu macam saya nak relatekan dengan yang tadi punya soalan, yang kes rajin tu. So, sebabnya kalau kita tahu essential oil ni dia akan berkaitan dengan bau dan emosi kan. So, adakah certain essential oil contoh transformation, hope ataupun essential oil yang berkaitan dengan dia orang cakap rajin lah and so on lah. So, adakah kaitan tu dengan emosi kita yang membuatkan kita tu berubah? Nak minta pandangan doktor lah.
I mean berubah kepada because memang dia punya tak boleh disangkal, dia punya relationship tu memang ada yang maknanya daripada bau-bau tu dia terus stimulate to parts of the brain, you know, otak kita. Jadi maknanya kalau macam kita kata and then the power of suggestions dan macam orang kata apa, kalau macam kita kata okay kalau you the power of kalau macam kita kata okay you ambil benda ni then insyaAllah everything will meet. Tapi at the same time kita katalah juga kalau you nak rajin you kena baca buku lah, tak lah boleh kan. Jadi maknanya I suppose that as a tool tu boleh lah kot, tapi maknanya janganlah to say I don't know you all lagi pandai benda-benda ni kan. You just can't
maksudnya nak cakapnya bila kita smell tu, so dia akan ada tindak balas dekat emosi kita dan daripada emosi tu kita lebih tenang, so kita akan maksudnya tindak balas pada kita punya fizikal juga. Macam tu.
Oh yeah, because the brain kita last at the end of the day apakah kita adalah otak kita kan. Jadi maknanya kalau kita nak jadi when the otak believes anything, everything is possible.
Okay.
Jalan pun boleh, maknanya orang kata kalau macam kita overcome fever pun boleh. Kalau otak tu dah percaya or dah